podcast series of Health Frontiers Insights from Global Experts. I'm your host, Dr. Kritika Upadhyay, and today we are going to have our episode on the health policy and planning in discussion with Dr. Mona, who is advisor at Health Policy Planning Division in the National Health Systems Resource Center, New Delhi. We welcome you, ma'am.
Thank you so much, Dr. Kritika.
So, Dr. Mona has 26 years of experience in health planning, policy making, program management, and she's been looking after this current division from a couple of years, and she's leading this as a position of advisor at NHSRC. So, today we are going to have a discussion with her and share her experiences in the field of leadership management in connection with health policy. So, ma'am, my first question to you would be that with your extensive background in health policy and planning and managing, what are the leadership skills which are needed for people who are in the same field, and how effective management and leadership is being done?
See, when we talk about leadership, we many a times talk about leadership styles. I think health is a sector where situational leadership works the best because things keep changing from one moment to other. So sometimes maybe a democratic leadership would add more value, where you go around and ask people what are the challenges, what could be the solutions, and then incorporate that in the policy. But then you can face something like we had COVID, and there you may need to become autocratic at times and pass a decision and see to it that people implement it properly. So I would say that it is more important that we adapt our leadership style as per the situation. I think more important than style is to have authenticity in the leadership. The person should be such that people are able to trust, which means that he or she should be able to deliver what they have promised. And if they are not able to do so, they should be able to go back and tell why they could not deliver. So I think if we have trust and authenticity, we will do wonders.
Thank you so much, ma'am. My next question is a little different from what you answered. You are also looking after the public-private partnership. Your experience speaks about that. So when we talk about public and private, both of them are different. So it's going to be very difficult sometime and challenging. So how do you maintain that the outcome should be beneficial for the public and the private, and there's not a conflict between them?
Yeah. I think we talk about public private partnership, but in PPP, the partnership is mostly absent. There is a sense of mistrust, distrust, I will say, between public and private. The government doesn't trust private all the time, and the private also has some questions in mind when they come and work with the government. I think that mistrust has to go before we start with the partnership. I think each party, be it government or private, they have their strengths and weaknesses. So, for any project, we should identify what is the strength, where can the private come in and fill in the gap, and where is it impossible for the private to work. So, say it is a green field. Most of the time, the private parties don't want to work on the green field. But if it is a brown field and we want to expand something, maybe the private could be a good opportunity. I think when we talk about PPP, most of the time we talk about for profit. Here, I think we also should take into account the non profit, the NGOs, the foundations. I think if we can expand and go to the NGOs and non-profits, I think we will increase our ambit and do better.
Great. Thank you so much, ma'am, for sharing your experience. I think the viewers who are looking at it and they are confused how the partnership is to be built, or they are working in the sector of PPP, it will be beneficial for them. The other arena, which is your strength, is the human resource management. And sitting at the policy level, where you develop the policies for human resource. And if we talk about developing countries where the challenge is the lack of human resource, so what your experience speak about how we can effectively manage if we have crisis, and what leadership role plays when we talk about human resource?
I think human resources, though, has been talked about a lot, but it has not been given the priority that it should. In fact, there have been a lot of leadership surveys. When the leaders are asked how important is human resources, it comes in number one. But when it goes to the implementation part or their to do list, it is somewhere eighth or ninth. So, human resource, they say it is important, but things which are to be done, those are not one of the priorities. Coming to health particularly, I think we keep talking about the numbers, that is the availability, but we are not talking about all the cadres. We are talking about the main cadres. Our most of the focus and attention is towards the doctors, specialists, nurses, lab technicians, pharmacists. But who is going to talk about epidemiologists? Who is going to talk about speech therapists? With the elderly population increasing, what will happen to the physiotherapists if we do not start working on these numbers? Then the human resources is not individual led, it is a teamwork. So we should also think about the skill mix in the team. I think the other things that we have not been talking about is what is the geographical distribution, what is it that we are doing to take our human resources to those far flung areas where we do not have healthcare access. Then the behavioral part of the healthcare providers, but both, not only providers but also the public, we need to take some concrete steps towards it. And I think quality is another area where what is the quality of the people who are coming and joining us. And something that we do not talk about so much in government is their productivity or their service utilization. We have people in our facilities, but are we utilizing them well? Do we have enough drugs and diagnostics and proper infrastructure also so that our human resources can perform well? I think these are some of the challenges and solutions.
Thank you so much, ma'am. Hearing it from you itself tell that you have vast experience and you are working in this field yourself. And I think to the viewers who are seeing this, of course, like I said, we have this human resource challenge. I think universally everywhere in LMIC, the lowest and the middle income countries. And I think the little solutions which ma'am has given in this podcast will be beneficial and important to you. So my next question to you, ma'am, is like India being a very big country, and you are in the policy making, and when we talk about the bigger programs, the development, the planning, and then the implementation. So how all these things go, and like in this program, this is a policy program where mid-level and the senior level managers were involved. Do you think that their viewpoint or their voices should also be included in developing a health policy, and how pertinent are they?
Absolutely. I think the voices of people who are working not only at the top but also at the middle and at the implementation level matter very much. In fact, these voices should form the core of any policy, because I think we keep talking about the street level bureaucrats, but these are the people who are implementing and know the actual challenges. They also know about the proper solutions, the solutions which will actually work at the ground level. So people who are at the policy level, they might have lot of knowledge, they might know about the best practices from other countries, but what actually will work in our context, I think this comes from the people who are there on the ground, at the middle level and below that. And I think definitely there should be a mechanism. In fact, best of the policies are those where there is a loop which is completed every time through the feedback, that we have a policy, we implement it, and then we have a very fast feedback loop. And if at all there is something that we need to change about the policy, we keep changing and making it better.
Thank you so much, ma'am. My last question goes to you, being a women leader and leading a very big department, giving your important viewpoint and making decisions. To the viewers or the emerging leaders who will be seeing your podcast, what key tips or leadership tips you want to give to them?
To the women, particularly,
Particularly, okay, if you want to give it to the women.
I think, see, leadership is something that doesn't come easily. One has to sacrifice a lot. One has to lead through example. And we cannot cut corners when it comes to leadership. And especially to the women, I think we should not ask for any. We should also be equal to the men. Whatever it takes to be a leader, we should not ask for any concession that this I would not be able to do. If we are able to prove that we are equals, I think we will be given equal opportunity. And women are, they have some qualities which men may not get so easily. So I think if we use those qualities of understanding and understanding about the requirements of people even when they are not voicing it. Now, this is something that is very inherent in women. I think if we use these qualities, I think men and women alike, we can be good leaders.
Thank you so much, ma'am, for this wonderful discussion. And I think the viewers who are going to watch this, it's going to be full of insights and your wisdom. And we are really thankful for giving us time.
Thank you, Dr. Kritika. It's really a privilege to be here and talk to you.
Thank you so much,
Thank
ma'am.
you.
And to our viewers, stay connected with us for our next exciting episodes from Global Leaders. So stay connected. Thank you very much.